Women's Leadership Fund gave me about $5,000 to give to patients a device called an electrolarynx. This device is used for patients who don't have their voice box. Currently, we get about 12 to 15 patients a year who have the surgery with their voice boxes removed. Most of the patients at Tampa General don't have any funding. They either have Medicare or Medicaid. Medicaid does not cover the device. So this is about $500. How the patients use it, they put it on their neck like this, and they can say, "Hello, how are you?" And that's how they're able to communicate with their loved ones or anyone else in the hospital. Currently, we were able to donate 3 of the electrolarynges to patients in the hospital. Thank you so much to the Women's Leadership Council. It has helped our program tremendously. We're trying to grow this program with the disease-specific laryngeal cancer group, and I know by having this device available for the patients who do not have the funding, they're very, very grateful, and so is the speech department.
What we received from the Women's Leadership Council was a Dame wheelchair mover. We've been using it to transport all of our patients from the 3rd and 4th floor that are over 300 pounds in rehab down to the 1st floor gym on the main floor. One of our concerns was that previously, before receiving this equipment, we were having multiple wrist injuries and back injuries from our staff, especially our rehab therapy techs. And I'm very happy to say that since we've had the wheelchair mover, we've had no injuries of our rehab therapy techs or our therapists, especially any wrist or back injuries. So this is a great accomplishment, and we're so thankful for this piece of equipment. Thank you very much.
The wheelchair mover is our new piece of equipment that allows us to use a machine to do all of our pushing, so we don't put any strain on our back and we don't hurt ourselves.
We were able to get a phantom bladder last year, and that is what this box is, and what it portrays is an actual human bladder. And so what we utilize it for is our competency assessment program for our staff. 100% of our nurses and PCTs were capped on this bladder scan machine utilizing the phantom bladder this last year. And we also use it for our students, and so we have PCT students that rotate through every 6 weeks, and we give them a bladder class, and we teach them how to do capping, and we teach them how to use the bladder scanner, so we're able to utilize that with our training. And so what it is we're able to take our bladder scanner, place it onto the phantom bladder, press the button to scan, and then it actually gives us a true volume. So we're able to say that competently our staff can utilize the bladder scanner appropriately by having this machine or this little box. Otherwise, in the past where we're utilizing pillows, it's very inappropriate to use staff to scan because it is in an inopportune area and that's pretty private. So this has been great for us, and it's been able to help facilitate our training of our staff.
The new step. It is a seated stepper, and it has benefited many patients in our facility. And what it does is it provides a safe background for patients to increase their lower and upper body strength without risk of falling. And it's great for any type of post-surgical procedures so that patients can really get strong and therefore transition into the other equipment in our gym. And that's the whole benefit of it, is to get them mobile and up to doing their normal activities again. And I'd like to say thank you very much. And our patients have benefited greatly from this. Thank you.
Hi, I'm Mary Jane Harrington. I'm the Community Relations Manager at Tampa General. We're very, very grateful for the gift of the ultrasound machine. As a result, we've been able to work with Dr. Back and the ultrasound team here at Tampa General and provide the screenings to the community at 4 different places in the past year. And it's been a great benefit, and we've been able to prevent, hopefully, some potential AAAs, or at least educate the community on what the risks are so that they can avoid getting a AAA or help their loved ones in the process.
I'm Martin Back. I'm one of the USF vascular surgeons, and I've been involved with projects in screening for abdominal aortic aneurysms, which are a condition that affects primarily older folks with some risk factors that would include smoking and high blood pressure, and they can run in families as well. They're silent, unfortunately, these aortic aneurysms, and they can lead to death if they rupture. So we've been part of aggressive efforts to try to screen with ultrasound testing at-risk populations. And with the help of the Tampa General Foundation, they've helped to fund a specific ultrasound machine that we've used in a number of screening events in the last year. 4 specific events. We've screened close to 250 patients or individuals who've signed up from the community who come get a ultrasound test that looks at their aorta, which is a very simple, non-invasive test, and then we've been able to lecture them and give them some more information regarding aortic aneurysms and its risks and the treatments that are available for aortic aneurysms. We would plan on continuing future screening events that we will do both through Tampa General's Education Center in Hyde Park, as well as some of the outreach programs in Sun City, and to some of the local retirement communities who have reached out and asked for the services of aortic aneurysm screening.
Thank you very much.